Hi, this is Dr. Sharma from Colonel's Dental Spa, Bangalore, India. Food, whether it is stuck in your mouth or the food is kept as a leftover on the kitchen platform, food will always decay. Inside the mouth, the food decays pretty fast because the saliva contains millions of bacteria and the temperature is a little higher inside the mouth as compared to the room outside where the food may be kept on the kitchen platform where the bacteria in the air will grow up on it and the temperature is lower. So food, if it gets decayed on a kitchen platform in 12 hours overnight, inside the mouth it will get decayed in about 2 hours. Why? Because the process is hastened because of the bacteria and the temperature. Now, the food which is stuck inside the mouth has to be removed. When we get up in the morning, it's not the teeth or the gums that smell. It is this food that smells. When we get up in the morning, there's a foul smell from the mouth. So brush your teeth after meals. Gone are the days when we get up in the morning, brush your teeth and you say you are good for the day. You are no more good for the day because the type of food that we eat nowadays is all processed food. Even if it is home cooked food, contains oil, sugars, which make the food very, nutritious, delicious, colorful, but it also makes the food sticky. So it sticks on the tooth surface very hard and does not get washed away with the saliva. So that is where the role of a toothbrush comes. So we need to brush our teeth after meals. I always recommend brush teeth after every meal. But if you feel it is not possible, so at least after breakfast in the morning and after dinner in the night. Get up in the morning, brush your teeth, don't count it as one. Count one when you brush after breakfast and count two when you brush after dinner. A toothbrush can remove almost 70% of the food from the tooth surfaces, but large percentage of food is stuck between the teeth. That is where the bristles of the brush don't reach. So that is where the role of a dental floss comes. So when we pick up a dental floss, there are three things to be remembered. Number one, we have to use a dental floss. It has to be learned how to use it. We have to insert the dental floss between the two teeth. We are not trying to remove the food debris with the dental floss. We just try to dislodge it. So if your gums bleed while flossing, the technique is wrong. So learn the right technique from your dentist. Flossing once a day in the night after, before you hit the sack, before you go off to sleep is always a better idea. Flossing has to be done. Some people ask me, has it to be done between every tooth? Yes. All the gaps between the teeth have to be flossed once a day in the night and then vigorous rinsing to dislodge the food debris from between the teeth. People think that harder they brush, more they clean. Actually, harder you brush, more you damage. The idea of brushing is not to shine the teeth. The idea of brushing is just to remove the food debris from the tooth surfaces, which is soft. So brushing with a toothpaste after meals is something which is very important. When you pick up a toothbrush, remember three things. Number one, the brush should be soft, the technique should be right, and brushing has to be after meals. Using a mouthwash is a good habit. Mouthwash contains certain medications which reduce the number of bacteria inside the mouth. Now, mouthwash, please remember, is not an alternative to brushing. It is an addition to brushing. Again, when you pick up a mouthwash, remember three things. Mouthwash should be used in full concentration. But if you feel, for example, you take about 10 ml of mouthwash, if you feel it is too strong, dilute only 50%. Take 5 ml of mouthwash and 5 ml of water. Number two, swish the mouthwash inside the mouth for 30 seconds vigorously so that the mouthwash passes from between the teeth. Throw it out and don't rinse with water after that. The third and the most important is don't use the mouthwash immediately after brushing with paste. There should be at least a 45 minutes to 1 hour gap. Use a mouthwash at least an hour after brushing because the calcium and phosphate radicals inside the toothpaste, they neutralize the mouthwash. So immediately, some people are in a habit of immediately doing a mouthwash after brushing. That gives a false sense of well-being, that ha-ha feeling that we have inside the mouth, the freshness is actually the mint. It is not the medicine. The medicine inside the mouthwash is tasteless. So use a mouthwash at least an hour after brushing. Twice a day use of a mouthwash is a good idea. Oil pool, I have seen in my almost 40 years, that is a very common thing in India which people practice. I believe in science, and there doesn't seem to be any evidence or longitudinal studies where there is an inference which says there is any benefit of oil pooling. I personally do not see any science behind in my oil pooling. In my practice, I have seen that some people who do oil pooling, the infection, if at all per se, goes deeper inside the gums. It gives a false sense of well-being by patient feeling that the gums have become a little more stronger and healthier. It does not happen so. I personally don't subscribe to oil pooling. Oral irrigators are very effective and should be used on a regular basis. Oral irrigators are an alternative to flossing. Flossing sometimes can be cumbersome for senior citizens to negotiate a floss between the two teeth, especially in the molars or the teeth which are inside. There is very strong research supporting the effectiveness of oral irrigators for improving the oral health and gum health. Some key findings include oral irrigators can cause reduced bleeding or gingivitis, improved reduction in the pocket depth and bleeding, reduced gum inflammation and plaque, and they are safe and effective. They don't cause any damage. Sometimes wrong technique of flossing can cause bleeding of the gums, which is actually a damage to the gums. Oral irrigators don't cause any kind of a damage to the gums. They flush out the food debris and the bacteria from between the teeth, areas which are generally missed out by brushing, where the bristles of the brush don't reach. And it is ideal for people who have sensitive gums, who have braces where you can't insert a floss, and sometimes patients who have implants or crowns. So choose a model with adjustable pressure where the settings can be adjusted. There are several available in the market.